I'm very thankful to the entire team of Stanford for helping us organize this special conference on Global Heart Network. The need for such a work has already been told, and I'm sure every one of us in this room appreciates how important it is to save our children who are born for no fault of theirs with a problem with their heart. And most of these children are born in rural, remote areas to poorer parents. And as far as I see, CHD is a poor person's disease. And therefore, it's important that we provide accessible, equitable, affordable routes to recovery from this sickness. And that's possible only when we all collaborate together. So in India, there is this saying that comes from a great Indian ancient text. We call it Maha Upanishad, which says, Ayam Nijaha Paroveti, Gadana Laguchetasam, Udara Charita Namtu Vasudhaiva Kutumbakam. It's in Sanskrit, a very ancient language. And what it means is to think that these people are ours and those are others is the way of the narrow minded people. To think all of us are a family is the way of the broad minded ones. So, this whole mission has been founded on this one principle of Vasudhaiva Kutumbakam, the last two words from this verse, which means the whole world is one family. And that's what we are trying to celebrate when we come here and shake hands with the likes of the Clarksdale Hospital, led by Lori, and of course, coordinated by John. And this is a watershed moment for, I think, healthcare in the US, because it's for the first time that a group which is so diverse, which is so heterogeneous actually, and comes from various parts of the world, comes together to contribute for a hospital down south in Mississippi for the betterment of the mother and child services. It's not from the government, it's not from private corporate, it's not from a grant making organization, but this is a collective contribution from several individuals from around the world who believe in this idea that we are one family. So if there is a child born in Clarksdale and needs some help with NICU or other facilities, he must know that there is this whole world out there which is there to help the child. And when that child grows up with this sense of gratitude that when I needed help, the whole world came together for me, can you imagine the kind of person that the boy or the girl would turn out to be? And this is how we sow the seeds of goodness in the hearts of the young children, to those who are vulnerable, marginalized, to those who need our help, and create a better harvest of humanity in times to come. This is the core philosophy of this whole effort, that we should bring people closer. I know US is going through several ideological battles at this point in time, but I think everything can be smoothened out, everything can be harmonized in this one idea that we are one family. Yes, in the family we have differences. Who does not have differences? But then we don't abandon each other. We still look after each other, we still care for each other. And that is the idea of being a world family. I believe in this idea firmly, and I also believe that this is the only solution to all the perils that the world faces today, from east to west, from north to south. And any country that I visit, I talk about this idea that treat each other as a family, and you would know what to do with each other. You would be able to forgive each other, you will be able to overlook each other's deficiencies and faults, and still be able to live and love each other. This is the idea that can perhaps redeem the entire world at this point in time. And this is what we promote and propagate. But we just don't say, but we do. We show it by practice. And today I'm so glad that it's been, I think, 7 or 8 years since we've been talking, John and of course, Lori, I met last year. We have been talking about the situation of healthcare, even in Delta region, down south. And I know this hospital has gone through lots of ups and downs. It was almost closing down. And I remember John and I having a very intense conversation about it. And I told that you can't afford to close down a hospital. That's sacrilege. You cannot do this to your people. You must find ways to keep it going. And I learned that in the last couple of years, especially during COVID times, so many hospitals shut down because of lack of revenues. And I wondered, how can the strongest economy in the world, the largest GDP in the world, cannot afford to look after its vulnerable sections? So it only brought the gaps in the system to forefront. And we said the only way out of this whole thing is collaboration, partnerships, to work together as one united group of family members who would do anything to save that child in the family. And that is how this idea was mooted. Last year we were there, John and Laurie and the team, they did a marvelous job of turning around the whole hospital and made it breathe again. And they did all the right things to ensure that this hospital did not shut down, though there were 5 other hospitals in the neighborhood that shut down during the same year. So this is definitely, this was a risk. You could have taken the easier path of saying, I tried my best and it doesn't work, sorry, I'm going home. But they did not do that. They stayed on, they fought, and that's what encouraged us to support them further. So when we met John last time in Fiji, where we have a hospital, you must have seen the presentation. John said, can we all work together and do something about this hospital? And the most important thing that is needed is the mother and child care, which needs to be upgraded, modernized, make it available for everyone in that region. So that is how we began. I know it's a small beginning, John, but this is the first of many such good things to come. More important thing is that this is the first time we have joined hands together to do what we always love to do, to help people. And in Clarksdale, we also have a small enterprise called the People Shores, which you just saw in the video. It's also about picking up the marginalized and vulnerable sections of the society, the youths from inner cities and rural areas, and get them trained and get them employed so that they can earn their own living. They do not have to depend on others. And that's another thing that we found during one of these visits. I think it was 6 or 7 years ago. We were passing by some signal in, I think, San Jose Bay Area somewhere. And I saw a park next to that big signal. And there were a lot of people over there in the park. And they were all seemed to be having a good time. So I asked these people, is there a picnic or some festival going on? Why are there so many people in the park? And I was told that they are all homeless. And I looked at them, they were all youngsters. They were in 20s or maybe even less than 20s, in their teens. And I asked, why are they outside? Why do that? They have some home to go to or work to do or studies. They said, this is how it is. There are a lot of people. This is the underbelly. And a lot of people live like this. And that's when I told Murali if you could do something about it, because he was running a successful enterprise in India, which is called Rural Shores, which was about taking jobs to the rural parts of the country, training the rural youth and then getting them employment. And, then they move on in their lives and do many things. The same thing was applied here. And the first effort was the office was incorporated here in Bay Area. And then in Clarksdale, we have a center. I think there are 40 plus people who are working there. Most of them are women. There are single mothers, unwed mothers. These are mothers who do not have any other support system. And if not for these employments which are available next door, they would have to drive miles and miles every day, maybe do 2 jobs a day by locking their children up at their homes. They would get to see them again only in the night when they return. So this is the kind of situation that we witnessed, and we thought we must do something about it. All knowledge must end in action. Knowledge is of no use to anyone. It has to be actioned. And this mission is all about actioning our understanding, our knowledge, our compassion. And with People Shores, it started thanks to John. And slowly, when we learned about the healthcare issues over there, which was told to us by the people, we also took the initiative to start a small clinic in our own way and integrate it with the main hospital. And today, this is another step forward in building bridges between the haves and the have-nots in our own communities, and building a better society, a better country, and a better world for each other. So I'm extremely happy that you could come all the way, the whole team. And where could we do better than doing it here, right here in Bay Area? Because I believe anything that starts from the Bay Area definitely succeeds, and that's how it has been. So I told our people, if you must incorporate a foundation, the One World, One Family Foundation, please do it in Bay Area. Because I think there is a magical touch here. People are so enterprising, so energized to do good things, and I'm sure this will multiply itself in times to come. So we have begun the journey. It's only the first step. I know there are miles to go before we sleep, but I'm sure every good journey begins with this first step has been taken on this front of collaboration and partnerships to create a better tomorrow for ourselves and our children. The other thing of Global Heart Network, thank you, Sean. That was the main agenda. I'll come back to it. We've seen a lot of kids, dying around the world. We've opened many centers, but as you would understand that it's not easy to get specialists to come and work in these centers. like Fiji Islands. It totally the hospital runs because of collaborations with several people, several doctors, surgeons, including the ones from Stanford. They come there, they perform surgeries on a voluntary basis. The space is available, the infrastructure is available, the patients, of course, are available, but we needed the expertise. And that comes from several parts of the world. So this is the model I thought for the developing countries, rural areas, where people from larger institutions can volunteer their time, spare some of their time to go back to their communities and do something. But the major hurdle they face, which I was told by another foundation, the Little Hearts Foundation from the UK, is the quality of infrastructure in these areas. They did mention to me that when they went to Africa to do heart surgeries, they found it extremely difficult because the quality of infrastructure was not supporting their kind of work. However, in our hospitals, we have made a point that all infrastructure is as modern as possible. It's state of the art. Even though it is completely free of charge, we do not compromise on the quality and safety of the patients. And that is something which is very unique to our ecosystem. So we have 5 hospitals in India. We built one in Fiji Islands, quite far. We built one in Sri Lanka, which is again very close to India. We built a hospital in Nigeria too, which is a general hospital, a mother and child center like what we're doing here. But hopefully it will get upgraded to a cardiac facility soon. We are also planning to build a heart hospital in Turkey, because that's again sits in the middle of Europe and Asia, and there are a lot of people from those Middle Eastern regions which are war-torn all the time. There are conflicts. Those kids can also be saved. So Turkey is something that is in the offing. In coming time, there'll be one in Latin America, probably in South America, probably in Argentina and somewhere. And then hopefully one day, John, are you listening? You're all ears, okay. Hopefully one day, as we start with the cardiac screening program in the US for the kids in and around the Mississippi and Delta region, and if we identify these kids with any of these heart diseases, just call Stanford. I'm joking. What I mean is, we will have people from Stanford and from everywhere else join hands, fly down to Mississippi, and get the things done. And we will support that as a foundation, whatever it takes. As far as it lies in us, we will continue to work towards the cause of congenital heart diseases. And we will also collaborate with this prestigious institution. I was telling Dr. Anand that we must do more research to find out the causes for it, so that we can prevent it from happening, because we cannot afford to treat it most of the times. So I'm looking forward to a very productive and mutually beneficial partnership with this prestigious institute, Stanford, with our medical college back in India, and with Clarksdale Hospital, to start solving the problem of CHD in the US, one child at a time. I again thank everyone for their generous contributions for this particular collaboration, to the entire faculty and the people of Stanford, who have been very nice to us in the last few years. We have had many conferences. They've always been supportive. To Dr. Anand, especially because he's the one whom I call if I have got to do anything with Stanford, and I'm going to give him more work, I promise that. And now Sean, who has joined Stanford very recently, is the youngest kid on the block in this system, and I'm sure he's a surgeon par excellence, and he has tremendous compassion in his heart to not just the competence of skills. And you'd go a long way in building these bridges between the haves and the have-nots. And I'm sure this will turn into this global heart network that we are building today would go on in the future to embrace all the kids in the world, and will connect them to the right kind of doctors, right kind of facilities and centers, so that no child who needs such help is ever denied or deprived of it. That would be our final vision. I'm sure this is just the beginning. There is a long way ahead, but with all of us together, one step at a time, I'm sure we will reach the goal more sooner than later. So once again, wishing everybody all the very best, thanking everyone who has been a part of this wonderful mission, and looking forward to hosting a conference, the next one, GHM, at our medical institute in India. And I already said I am personally invite the people from Stanford to do join us and share your experience as well. Thank you very much. As India, they say, Sarve bhavantu sukhinaha, sarve santu niramayaha, sarve bhadrani pashyantu, ma kaschid dukkham apnuyat, which means may all be happy, may all be healthy, may all see good and auspicious things everywhere. May no one have any sorrow. With this universal prayer, I close. Thank you very much and namaste.